So today's sort of getting young people introduced to sort of health services that they might have accessed or might access in the future. Is looking at their knowledge of what they've accessed already and hopefully improving it by looking at sort of health scenarios that might be affecting them in the future and what they do in those sort of scenarios. So ultimately it's looking at what young people know about health services and then looking at their feedback of sort of health services they've accessed as well, because feedback's very important for young people because changes can be made from that, and obviously health services can be improved upon the feedback that we get from the young people from here today.
We don't get taught very much about health, and it is quite difficult for us to know whether we have to go to GPs, walk-ins, and so I thought it helped a lot with that.
Today was very interesting. I didn't know much about the 111. I thought it was going to be more I thought it was more for emergencies, not for advice, so I learned a lot about 111. I think I could have been more on mental health and more physical health.
Today I think the one thing that we need to do more of is actually look at mental health service provision for young people. That was one thing that came over, in particular in relation to abuse of social media and the impact that can have on young people. They've really changed my views about how we can communicate with young people. We talk about use of social media, but what their understanding of social media is, it's very different to mine.
Normally I tend to spend my lunch times inside, but after watching this I realised it's probably best to be outside and socialise more, and then that means I'll be getting more oxygen and being healthier.
One of the things that young people were very aware about was sometimes the difficulty of getting GP appointments and the length of time. So, and I suppose the other area was their lack of thinking about, shall we say, going to the pharmacist as one of the first ports of call. And I think that, again, the messages that were got across by the young advisors about the alternative ways that people can access the NHS is well worthwhile. And again, we really do hope that it percolates out and gets across to all the young people in Sefton.